like at least a 55-inch TV, so they can really see
interesting.
that crack in their tooth, right? There's no denying it when it's in HD right up in front of them.
Welcome, everybody. Welcome, Phil. I'm very excited to have you here. Phil Cassis, the CEO of Providence Dental. The podcast that we're doing here is actually live recorded for the Dental Leadership Summit. So welcome to the podcast.
Yeah, thanks so much for having us, Ralph. Dental Leadership Summit's one of my can't-miss events every year, and happy to be back here again this year.
Yeah, thanks. So for the audience to know, Phil goes way back in the dental industry. I'm going to give you a chance to kind of introduce yourself a little bit, but many of you will probably know you. Yeah. But I do think that your career path is a very interesting one that is, for me, inspiring for other people to learn about. So why don't we start there? Like, how did you end up where you are today, and what insights do you want to share?
Yeah, so again, thanks for having me, Ralph. I grew up in the dental industry. My dad's a dentist, still practicing, going on 45 years now. Got a lot of family members who are dentists. My brother is an endodontist, sister-in-law's a dentist. So I grew up going to dental shows for family vacations. And so came by it honest, right? And so while I was non-clinical, always found myself interested in the business side, and kind of led me to a career with Henry Schein. I spent 12 years at Henry Schein, and a lot of that was spent more not in the supply space, but more so business consulting for practices all across the country. And so I had the privilege of working with them and working with a lot of their customers and learning what challenges they had and being able to bring solutions to them to help them grow their dental practices. And so kind of led me to the opportunity with Providence Dental Partners. One of those people was my partner, Dr. Jason Mann, who was the founder of Providence Dental Spa out of Macon, Georgia. And, out of the 1,000 or so dental practices I've visited over my career, I can count on one hand how many are at that level, right? When you talk about the clinical dentistry they do, the patient experience they deliver, and couldn't have been more thrilled when he said, yes, let's do this. And I always told Dr. Mann, everybody deserves a practice like Providence Dental. And so that's kind of our goal with Providence Dental Partners, is to take that same experience to as many practices as we can.
Before I jump into my questions, I do have one more personal question. You mentioned that your brother is a dentist. Is it your older brother or younger brother?
Younger brother. He's an endodontist.
Younger brother. Okay, so there was a lot of pressure on you to go into dental as well. What was there competition between you two? Because he is a dentist and you went in the non-clinical side?
Yeah, so there's actually 5 brothers. So I'm one of 4.
Lordy,
so competition was everything we did. But my brother Daniel, who's the endodontist, was always the smartest out of all of us. So we knew, early on.
So there wasn't really a competition?
Yeah. So no, I didn't even want that competition with him. So he's very smart, very talented. He's got a beautiful endodontic practice in Louisiana. And so I've been really proud to kind of watch him grow in his own dental career. And his wife has an amazing dental practice of her own. She's a general dentist. And so but as far as competition, no, he was always way smarter, and so knew he was going to go that route. I just didn't always envision myself being on the business side of dentistry. And
interesting,
it was really my time at Henry Schein, and being able to work with dentists and listen to the challenges they had. And a lot of the time it wasn't clinical, right? It was more so the business side. We're here at a conference with an HR company, and those are the things that really keep them up at night, and where they don't have the expertise. And you look back to that generation of dentists, like my dad, they had to wear many hats in the practice. They were the marketer, the HR, the payroll. They had to do it all. And that's really where I found my calling, was to be able to help alleviate some of those challenges and stressors to dentists running their own practices. And kind of continuing that with Providence Dental Partners, we provide a lot of support services to our practices and really empower the dentist and elevate care so that they can focus on what's most important, and that's taking care of the patients.
So first, I think you didn't have a choice. Like you could only become some part of the dental industry, which is fantastic. They're glad to have you. You said something in your first answer that I think stuck with me, and I want to kind of dial in on that first. You mentioned Dr. Mann. His practice is a practice that everybody should have and or deserves. And so I want to go a little deeper in that direction, because I think you mean both patient, but also employees or the business itself. Is that, am I hearing that right?
Yeah,
or explain that a little better.
It's a combination of things, right? And that's really what we do in the dental business, is put all those things together to really create the patient journey and the experience that we want. And so that's really where I help the organization a lot, is being able to map out that patient journey, right? And there's over 100 touch points that a patient's going to experience with us from the time they know they need a dentist, they go online, they look at reviews, they read referrals, they call into the practice, they show up at the practice, insurance is verified, the whole revenue cycle processes, to the time they're sitting in the chair and the doctor's explaining to them what they need. That is where case acceptance started. It's at the very front of that patient journey map, not necessarily when they're in the operatory and the doctor's telling them what they need. It's all those touch points aligning to create a sense of value and allowing them to say, yes, I feel comfortable with this and I know I need it, and so it's not necessarily hey, do I need the dentistry or the new iPhone? They know they need the dentistry, right? And so, and that's what we compete with a lot of the time. It's that discretionary income. And so we have to understand, almost from a retail perspective, that we're creating an experience that allows patients to say yes when they're in our clinics. Yeah,
interesting. Because I think that being part of HR for Health, there is a very important component to having happy employees that will allow for a happy patient experience. And I don't think that a lot of people connect the dots, right? And I think so I think that's where your company and you in particular are driving towards. So which leads me to my actual first question. How many minutes in? 10. So you talked a lot about building a culture of fun and transparency. We all know there's a tight labor market in dentistry. How do you feel, or what are you seeing the risks of burnout and or other issues are in this industry, and how do they affect your practice, other practices in the DSO space in general?
Yeah, and I think that's a great question. And coming out of COVID, right, it's something that everybody's dealt with, and it's still lingering, right? And I don't know that it's ever going to change. This is the new normal. And, and so we're always closely monitoring that. Say we're perfect at it. No, we're not those people. We know we have things to always be working on. We're always in a stage of becoming better than we were yesterday. And this is one of the most important things, right? It's like Bo Schembechler said, it's the team, the team, the team. Same thing for us at Providence Dental. And I don't care what industry you're in, people love to show up to a nice facility. That they have the tools and the resources to do the jobs that we're asking them to do. And what we ask our teams to do is deliver on a patient experience that goes beyond traditional standards. And so it's incumbent upon us to make sure we're providing that. And so all of our facilities, whether it's a Providence Dental spa or other, or spa-like facilities, we want them to come to work in a nice facility. We want them to have state-of-the-art equipment. We want them to be patient-centric and really focus on building genuine relationships with our patients so that we can serve them at the highest level. And so, but for us, it's, mission, vision, values. We align those, we live those, we speak them every day. We're always always trying to become better at that, right? Because it's so important. It's important to us as leaders, but it's even more important to the teams to fill that. And the values is really that non-negotiable piece, right? And
So what I find really interesting about you as a leader of this organization is you're very vocal about the team satisfaction, but also about deploying new technologies. And everybody's talking about AI and this and the other, right? So talk a little bit about that perspective of how does AI, or how has AI come in to your organization? What impact does it have on the practice as a whole, but also on your employees, on patients? Like give us an idea of where you are and what are you excited about? What's going on there?
Yeah, so we're very progressive just by nature and our own personalities, and so we lean in to these technologies, whether it's clinical technology or business technology. The world's not going to slow down for us, and so we have to make sure that we're staying on pace and adopting technologies where it makes sense. We're a high touch dental group. You can't can't really trade that off, the value that it becomes a person-to-person connection and relationship. But there's a lot of things that can help us get better with AI on the clinical side, being able to audit pretty much automatically, right, for quality control, risk assurance, things like that.
Interesting.
Our clinical leadership team is small at the stage we're at, but AI gives us the ability to have a much broader view across the organization and the clinical dentistry that we're doing. On the business side, there's so many applications that we can use. I think at this point, everybody's using ChatGPT and all these other ones, but really excited about the gains that they're making in the dental industry around revenue cycle management's a big one, right? Being able to help collect 100% of what you should.
Sure.
Always excited for the new HR for Health updates. I learned today that there is AI now in that's helping support our practices.
Yeah, 100%.
So really seeing it come in marketing is another one. And it's all these things. It's really about the education, right? A lot of people are fearful of AI, and is it going to replace me? Is it accurate? All these things, and that's really our job, not just us, but all of our partners, to come in and help educate our teams about what AI is and what it isn't. I don't know that it's ever going to do exactly what we do. It's just going to make us more efficient across the board.
I agree with that statement. Yeah, I think that is a very important part. So I think that. What I'm hearing you say is this cultural fit is really important for you, for your growth. So I kind of want to swing over to more the business side of your company. So Providence has done quite a few acquisitions. You've grown. When you do an acquisition, talk to me about what is it that you're looking for? How does your cultural experience and the emphasis you have, like what fit are you looking for? What are no-goes? What are yes, no, maybes?
So it all starts with alignment, and that's alignment. I mean, there's 250 plus things that we look at every time we go into a partnership. But number one, it is the partner, the
so it's
seller.
Literally a checklist?
Wow.
Okay.
And everything's weighted a little bit differently. Obviously, there's got to be financial terms and structures and things like that are agreeable by both parties, right? But really, a lot of it comes down to just the partnership that we have with that doctor. And is this somebody that we want to partner with? And do they want to partner with us too, right? And we're a little bit more transparent, I think, the most upfront about, hey, this is what changes, this is what doesn't. We'd rather tell them and just be open and honest upfront and have a clear understanding of who we are, and to see if they're going to align with our culture and our identity. But a lot of it comes back. The first thing is always clinical philosophy. My partner, Dr. Mann, always has first right of refusal, right? If there's not clinical alignment there with a practice or a partner, the financial side of it doesn't matter. And so, and we understand what he's looking for, and so we can help through that vetting process, due diligence process, but it all starts with that first. But really it just comes down to the person, right?
So in your experience, is there, and I'm asking this because I think that a lot of our listeners are in that same phase where they are like at 2, 3, 5, 7 locations, right? So they have some experience, but they are nowhere near the experience that you have. So my curiosity is there such an experience as you just walk in the door of a practice and go like, yes, absolutely. And you walk in another door and you're like, hell no. Like, is it as easy as that? Or where like is there other insights?
There's situations like that where it's a quick yes or a quick no, but usually it's a drawn out process, right? Over 3 to 6 months, just you're going to date before you get married, right? So very similar in the dental side. We want to sit down with them and both in practice, but outside of the office too. I want to go to dinner and just, get to know them and allow them to get to know us and make sure there's a good fit there. And so, yes, experience is great. We're only at 12 locations right now. So we've still got a lot to learn ourselves. Experience is the best teacher. And, that's one of the reasons we come to this event every year is we're always learning from somebody here who's been down that road and can kind of give us guidance, say, hey, take the left in the fork in the road and watch out for the bridge ahead. It's out. And, so we're just going down our own journey and trying to learn from those who have been there before.
At the end of 2025, I think it's fair to say that our industry is going through what I would call somewhat of a transition. I think that times are for some somewhat difficult, but like there is a financial policy that may not necessarily be as healthy and as easy as it was, let's say 3, 4, or 5 years ago. So with flat reimbursements, with other headwinds, clearly you have found a successful path. But how do you see yourself maneuvering through what's honestly really going on, right? Like I think that there is like when we can address this honestly, there is people who are struggling, right? And so like, what does that look like for you guys? How are you addressing that?
Yeah, well, I think in any business, right, you got to keep a focus on the customer. In this case, our customer are the patient, right? And so we know that if we deliver an exceptional patient experience, we're going to have more and more patients come by. The numbers are always going to fluctuate, right? Some costs will go up, some will come down. And we as leaders have to be able to navigate that and make sure that we're not just sustaining today, but preparing for the future too. We're not aggregators, right? So we're not just in this to go see how many practices we can buy over a certain period of time. We're dental people. And so we're going to be in this for the long haul. We have to have sustainable operations. And that's our growth model. We don't have to go out and buy 15 or 20 locations every year. We'll take 5 of the right ones or 3 of the right ones. If there's 10 right ones, we'll do that too. But it has to be the right mix and the right fit, both for the sellers and for us too. But keeping the customer, the patient central is critical to that. And everything we do, it's quality over quantity, and that starts with our patient.
Yeah. So what I hear is what other people in the industry would call same-store growth. Give me like an idea of what you see most often lacking, where you come in and go, here are things we can do to improve customer experience, et cetera, et cetera.
Yeah. And so old Tony Robbins' philosophy, there's only 3 ways to grow a business, and that applies to the dental industry too. You can raise your fees, see more patients, or do more dentistry. And so not quite as simple as it sounds there, but when we talk about raising your fees, it's meaning, are we collecting 100% of what we should from the insurance companies, our revenue cycle? Are we maximizing the reimbursement schedules? Are our fees set to where they need to be in the industry and in that market to be able to receive the max benefits? And so there's a lot of things that go into collecting the most that we can without just raising our fees on our patients, right? And so we always start there, seeing more patients. Some practices we have, we can't see more patients, we're out of room. And then some, it's, hey, we can see more patients, right? And so, and it's not just about, again, going back to the quantity of patients, we really like to dial in our marketing and really focus on our brand. So we're not just attracting more patients, but it's more the patients that we want in our clinics. And so being able to make sure we're maximizing the chair time and space utilization is critical to be able to grow in our business. And then third is doing more dentistry, right? By no means am I talking about selling dentistry or doing dentistry that the patient doesn't really need. It's about expanding our provider skill sets, right? And so when we've got doctors who might be a general dentist, but maybe they want to get into implants and surgery and endodontics and ortho and all these different things, we want to make sure that we're supporting them by providing the training and the tools that they need to be able to grow their skills, and ultimately just be able to provide more services to patients so that we can meet them where they are and be able to customize treatment plans based on what their needs are.
Yeah. So along those lines, like I pulled some statistics where it said in 2025, the dental industry outlook found that an average case acceptance is only 42%. This was a subset of around 3,500 practices that they interviewed for this. So that is a very low case acceptance. So going back to the other questions around same store growth, clearly you are tackling that and you're working on that. And you mentioned clinical staff training and expansion of services. Elaborate on that a little bit more. Like, what do you do in your practice? Like, how do you make sure that the patients actually receive the care they deserve?
Yeah, well, and great question, right? And again, I'll go back to that patient journey mapping. It's finding out from the time they hear about our practice to getting into that operatory and having a treatment plan presented to them. That whole time, all those touch points, we're creating value in that patient's mind on whether they're going to spend their money on the dentistry they need or if they're going on a cruise next month. And so, but there's a lot of things to go into that, and we've got some providers that do it really well and some that, we're always in a stage of coaching and training and getting to that next level. But when it comes to case acceptance, how you measure, it's always different too. Are you measuring it as a percentage of treatment plans presented or the revenue that's associated with it? A lot of people, hey, you know what? You might need $15,000 or $20,000 worth of dentistry, but they can only do about $5,000 of that right now, right? So is that accepted?
Right.
Yes, I think so. As long as they're getting the care they need and can keep progressing down that treatment plan. And so
Sorry, I didn't mean to interrupt.
Yeah.
I'm just curious to see, have you seen a difference in behavior, patient behavior? And if so, what is it? And how have you guys reacted to it?
Yeah, so, and it's access to information, right? Everybody's got the World Wide Web. We used to have things like WebMD, and now we got ChatGPT, everybody's self-diagnosing before they come in, right? And so it's kind of a show and tell when they're there. We can't just tell them, hey, you got this big hole in your mouth and it's going to start hurting soon.
Yeah.
We have to show them too. And that goes back to our spa-like facilities and investing in the equipment and technology so that we can show them with 3D radiographs and with intraoral cameras and AI right now that has pointed it out. So it's not just our clinicians showing it, and we invest in TVs too, right? We like at least a 55-inch TV versus a small monitor so they can really see that crack in their tooth, right? There's no denying it when it's in HD right up in front of you. And so, and they want that validation, right? They need to know, okay, the doctor's not just telling me this, I can see it with my own eyes, right? Yeah. And I know that, that doesn't look good. What's going to start to happen? It's going to start hurting.
Totally.
And a lot of the time that problem is going to turn into a larger problem if you don't tackle it then. And so, again, it comes back to providing the teams with the tools that they need to be able to work through those with each individual patient.
Nice. So I think there's a lot of pressures on businesses like you, and look, you made it look easy, right? Like so it just brings, now that we know who you are and where you come from, right? Like yes, like that's like someone who comes out of a basketball or a tennis family or whatever. But like so, you live and breathe dentistry, right? But it is hard, and I think that there are pressures. So if you look for like into the future, like the next 3 to 5 years, right? Like where do you see this evolving into? Because I think that there is a specific pressure around the size business that you are. Where do you see yourself, and how do you manage that, and what do you foresee, I guess, in the looking glass that you have?
Yeah, I think it's all about partnerships for us. For Providence Dental Partners, that starts with a partnership with Dr. Mann and I. We're very aligned, and that's one of the things that we're both proudful of. Neither of us really have egos, and so we ultimately we think a lot alike. A lot of people think we're brothers, that we look alike, we do dress alike sometimes.
So if you guys haven't seen Dr. Mann, he's not lying. That is very true. I had breakfast with him this morning, and yes, you do look alike.
And even when we walk through our practices, sometimes they say, "Hey, Dr. Mann," and I'm like, "No, I'm Phil." And so, but he's such a great partner, and so that's core to what we do, and that extends to our partners, that come on board with us, right? We always seek to be a good partner first, because none of us know it all. We're all learning from each other. We're learning from groups that are bigger than us, groups that are smaller than us, but really keeping a clear vision on what we want and how we want to do it, and that quality over quantity mentality. Ultimately, if we take care of the patients and serve them at the highest level, we're confident our business is going to thrive for years to come.
So what I hear is essentially is your philosophy over that partnership, the I'm going to say the chemistry of your partners, the chemistry of your clinical staff is leading you to going, look, service first, money will follow. So I think that like, is that a fair statement?
Yeah, we're always going to have to be flexible on the business side, right? There's always going to be micro and macro factors that impact our business, that impact the economy, that impact our patients, right? And we have to be aware of those, and we have to be flexible in what we're doing. So we're in a constant state of change management, right? Which is not easy, but most great things are not. And so anybody that tells you that growing an emerging dental group is easy, no, it's not.
It's not.
It's not for the faint of heart. You have to be bold. You have to be confident. You have to be ambitious, and you also have to have some humility. Experience is the best teacher, and we learn from our mistakes. If we learn from it, it's not a mistake to us. As Dr. Mann says, fell fast, fell forward. And that's kind of the mentality we take to it every day. By no means are we perfect. There's always another level we're striving to get to. But we have to be willing to look at ourselves first and say, hey, what could we have done better today as an operator, as a leader, in our businesses?
Phil, thanks. I hope we gave our audience a inside look in what you guys provide. I'm fascinating watching your business grow. You're also the recipient of the Group Dentistry Award today, so congratulations to your organization. That speaks high praise to what you do, what you have done in the last couple of years. So congratulations. Thanks very much for being here. Very much appreciate you.
Thanks so much for having me, Ralph. It's a privilege and an honor to sit down here with you and to also be at this event every year. I remember sitting in the audience 2 years ago in Austin. And that was right before we were getting ready to launch Providence Dental Partners.
I remember that conversation.
I want to be on that stage one day getting that award. And so we appreciate you all in Group Dentistry now for recognizing what we're doing and the growth that we've had. And, our story's just getting started. We're going to continue to grow and keep challenging status quo and seeing if we can keep raising the bar in the industry.
Awesome. Congratulations. Thank you.
Thank you.